I received a message asking me if it was normal to have facial swelling after surgery. And the answer is yes, maybe. Let's discuss why it would be normal or why it could be a cause of concern. When you have surgery, typically we tell you to have nothing to eat or drink starting at midnight the night before surgery. Once you get to the hospital, to help with your dehydration and to keep you hydrated so that you're less uncomfortable before surgery, the nurses will typically start an IV. When that IV is giving fluids into your vein, only about 1/3 of that fluid actually stays in your veins and contributes to your overall blood pressure and hydration. The other 2/3 just leaks out and makes your tissues puffy. So if you're in the hospital for an extended period of time, or let's say even 2 days after your deep flap, if you have IV fluids running during that time, you get a lot of extra fluid that really just goes to making you puffy. This is why if you have surgery and go home and weigh yourself, you're going to be up several pounds. It's all of that fluid retention. So that could cause finger swelling, leg swelling, even a little bit of face swelling. That is normal and just takes a little bit of time to undergo what's called diuresis, which means that fluid goes back from swelling back into your circulation system, and then you just urinate it out, usually 3 to 5 days after surgery. But facial swelling can also be an early sign of an allergic reaction. And in an extreme form, it's called angioedema, and it can actually be life-threatening. Some patients can have this response to different medications like antibiotics or pain medication. So if you notice swelling after surgery that is rapid, or if you are noticing that you're starting to have difficulty breathing, that is concerning and you need to immediately call 911. But if you notice that it's just a little bit of swelling that seems to be equally distributed throughout your whole body after surgery, it's probably just the fluid, and it probably means you're just going to pee a lot in the next couple days and get rid of all of that extra fluid. I hope this explains the difference.